More kids in Jacksonville are in the hospital with COVID than any other time during the pandemic, but many of the cases are not severe, and most of the children are expected to be okay. News4Jax reporter Jim Pickett has been talking to doctors and parents.
Let's start with the numbers. Today, there were 24 kids with COVID at Wolfson, 4 in the ICU. Yesterday, there were 19 cases, and on Monday, 14. And through most of last week, only 3. For pediatrician Dr. Stephen Pattershaw, the increase isn't a surprise. He says it's mimicking what's happening across the country and similar to what's happening with adults.
Fortunately, what we're seeing right now is kids in general don't seem to be as sick as we have been seeing several months ago. A lot of the patients that we're seeing in general are being admitted, for the most part, for other reasons.
We heard the same from other clinics in Jacksonville, like Angel Kids Pediatrics. The CEO says more kids are testing positive than ever before, but the symptoms are similar to the flu. Statewide, the number of children in the hospital are also increasing, but that's expected to level out soon. We were also at testing and vaccine sites today, talking to parents about what they're seeing with their kids. Erin Mooney has 3 kids under the age of 5.
I do everything in my power that I'm supposed to make sure that my children stay safe.
She's had COVID before, and at that time, quarantined from her children. We also asked our News4Jax insiders to tell us about their children who have tested positive for COVID. Their responses were similar. My 5-week-old had it along with the whole house. I was so scared because someone at my hubby's job came to work sick. Stay home if you're sick. We are doing fine now. Another insider said, both of my kids are fully vaccinated and wear masks. They are COVID positive on day 3 right now, mostly cold symptoms. My 1-year-old is also positive and has had 103 fever for 2 days. My fiance positive and is having a severe body ache and lots of congestion. So while this illness may not be as bad as it was last summer, we asked Dr. Pattershaw what parents should do should their child test positive. Number 1, call their pediatrician.
Watching for any worsening symptoms. These would include things like worsening shortness of breath, decreased ability to take in liquids, getting dehydrated, or just really lethargic and not waking very well. Now, again, a very, very small subset of kids are going to have that trouble. Most are just going to have pretty mild symptoms. They might have a runny nose, cough, sore throat, headache, a lot of your typical viral symptoms.
Jim Pickett, Channel 4, the local station.